The first symptoms really were tinnitus, sometimes called tinnitus, ringing in the head, and that came about through a lifetime of noise exposure, and also some whiplash that I had on the tennis court. And about 6 months after that happened, I started getting the ringing. The experience itself is obviously not much fun because you feel out of control somewhat, in the sense that you understand maybe what causes it, but it's very difficult to treat. And it takes a while to find the right solution. And it can be, depending on the severity of it, and I think I had a fairly severe case, it can be very distracting and affect one's work life, one's social life, etc. Most doctors will say that there really is not much you can do about it, you have to live with it. That really wasn't a totally satisfactory answer, and started to do some homework into alternative ways to help. And one of them was clearly atlas orthogonal. I wasn't aware of the head being off center, the atlas being out. It didn't really appear until 6 months later when I got some x-rays with Scott, and then he said my head was 5 degrees off center, and we both figured out I better get my head screwed on straight. I was aware of the tinnitus, obviously. That was a darn nuisance, and it was a constant sort of ringing, and it was pretty heavy, and you try to find solutions and try different alternatives, and some work for some people, some don't. The symptoms weren't getting any better, so clearly there was something structurally at issue. So Dr. Bender thought it would be a good idea to use dynamic imaging to further understand what was going on in the neck, and what was influencing the tinnitus and the nervous system, as opposed to the regular MRIs, which I'd had, and which were all clear and showed some damage, but not nearly as clearly as the dynamic MRI did. And it was quite evident from that there was some damage from either that accident or a few other crazy things I may have done in my life, like falling out of trees and one thing and another. And so it revealed a lot more, and it was helpful in the continuing treatment. The treatment consisted of the atlas orthogonal technique, which at first glance may seem a bit daunting. You've got this machine there with what looks like a needle, but in fact it's extremely non-invasive and really quite pleasant. There's no real sensation, and the pulse goes through and corrects the atlas, and after that the blood flow is as it should be. The nerves tend to realign, and the whole neck feels a lot easier. And the tinnitus subsides. Getting that noise level down and under control is key, and AO helps to do that. Every time I have it, I can tell a reduction in the noise level, and it also gives you a feeling of more control over the issue, which is obviously helpful. Well, obviously I'm not a professional, but in my case I think that image-guided AO was significantly helpful, because it obviously helped not only the docs understand what was going on, but it helped me understand what was going on, so that we could both tailor further treatment. And I can only imagine that it would be very helpful in a number of other cases and different types of issues other than the one that I happen to have had. So I was very positive on it. It was certainly well worth it.